Hello everyone. In this video we'll be demonstrating the use of tissue adhesive in the management of corneal perforations and impending perforations like desmetocele. Tissue adhesives work well in perforations less than 2 mm in size. They work by various mechanisms. It polymerizes as soon as it comes in contact with water. It interferes with the interaction between the newly forming epithelium and stroma. It is bacteriostatic. It inhibits the collagenolisis, proteolysis, and stromal melting. Here are some general principles for application of tissue adhesive. The necrotic tissue should be removed. The field to be sealed should be dried out. The surrounding tissue should be protected from the glue application, and any corneal intraocular structural adhesion should be broken with the use of air or Hilone. In this video, we will be demonstrating the management of a case of keratitis with desmetocele using tissue adhesive with bandage contact lens. The first step is to perform careful slit lamp examination, which should be followed by slit lamp photographs and corneal drawings. So once we have decided to take the patient for TABCL procedure, it's important to know the material needed. So here is the vial of TA with pipette. Bandage contact lens is taken. 15 number blade mounted on barred Parker handle. Few Vexel sponges and buds. A non-traumatic speculum is taken. Here we have taken Lieberman speculum. So after the patient lies down on the OT table, paraffin eye drops are instilled in patient's eye. Gentle painting and draping is done with gentle application of eye speculum. It is important to dry out the area. If you apply tissue adhesive on a wet surface, it can lead to mound formation. After drying out the area, we debride the surrounding epithelium so that the tissue adhesive can stick on it. Here we have used the apex of the Vexel sponge to place a thin film of tissue adhesive. You can also use the back of the Vexel sponge for tissue adhesive application. So after the TA application is over, the BCL is placed over the surgical area. Here is the pre-op and the post-op pictures of the patient. You should patch for few hours and then remove and start the medications after that. It is important to know when to remove the tissue adhesive. Generally it is kept for 4 to 8 weeks. It should be kept longer for large perforations and neurotrophic corneas as they heal slowly. One good way to judge whether the perforation has healed or not is to lift the BCL with the bud and gently nudge the TA. If it easily falls out, then you can remove it. The other way is to look for the vascularization and epithelialization beneath.